¿Qué onda, plebes? Welcome back to another video. I'm the Mexican PA, a second-year PA student in Sacramento, California. I'm super excited today because on the channel, we will be comparing and contrasting the PA versus the MD profession. This has been a highly requested video, and I'll be doing this video with the help of a special guest. It is with great honor and orgullo to introduce my fellow paisano, Mexicano-Americano, YouTuber, and physician, Dr. Aaron Trillo.
Hola a todos, gracias Mario por tenerme on today's show. My name is Luis Aaron Trillo. Luis is my first name, but I go by Aaron. I am from New Mexico, and both my parents are from Chihuahua. I grew up on a sheep farm out here, and I'm just really glad to be here, and I hope I can help you guys make a good decision on PA versus MD.
And so the way this video is going to work is that we're essentially going to be asking each other the same questions to help you guys just get a better understanding of the differences that exist between the professions. Again, the goal of this video is to help you make the best decision for your future career in medicine. If you find this content helpful, be sure to like, subscribe, and comment below. And make sure you also check out Aaron's channel. I'll leave some details in the description below. And with that, we're going to just start, this video. So number one, Aaron, I'll be asking you first, your age, and just expand more on your kind of familial and cultural background.
All right, so I am 28 years old. I am first generation Mexican-American. Both my parents are from Chihuahua, Mexico, from the little ranchitos, outside of the main Chihuahua. And I definitely identify as Mexican-American, not Mexican enough to be in Mexico, not American enough to feel comfortable here.
Seriously, ni de aquí ni de allá.
Sí, ni de aquí ni de allá. So I definitely feel like I'm always in between. But, that's kind of how it is when you're a first gen in these, especially in like these professions of PA and MD. I grew up on a rancho, so I'm a ranchero. That's just a little bit about me.
Okay, great. And then I'll answer that question as well. I am 26 years old, and my background, I grew up in SoCal. I was born in Los Angeles, but I'm also a first-generation son of immigrants. My dad's from Guadalajara, Jalisco, Tapatío, and my mom is from Badiraguato, Sinaloa. So kind of, I know what you're thinking. It is Chapo territory, and that's where my family's from. Yeah, kind of how Aaron said, it's a unique experience to be in this position where you have to be kind of like more Mexican than the Mexicans and then more American than the Americans. But it, I think, provides a valuable lived experience that really helps and our patients. And so, yeah, we'll dive into the next question. Number two, what is your current education level, Aaron, and then just your educational background to get to this point?
All right, so I graduate medical school in about a month. So I will have an MD degree in about a month finally.
Congratulations.
Thank you. It took me 5 years to graduate medical school. Normal is 4 years. I did have to repeat a year of medical school, and it's actually a lot more common than people think. And, I like to share my story just because people don't. And I've had a lot of people resonate with this with me on my YouTube channel, like reaching out, like, thank you for sharing. Like, I'm going through this. It's the toughest part of my life. And now that I'm about to graduate, I got into an amazing residency that I can let them know, like, it's going to be okay at the very end of it. Before this, I got a 4-year degree in college. I was a biology and chemistry minor, and I double majored in Espanol. That Espanol major was cheating because, I just cruised right through it.
Yeah.
Before I started medical school, I did work as a community health worker at my academic hospital.
Got it.
For a year before I was accepted into medical school. And I did have to take the MCAT twice. I had to apply to medical school twice. Pero aquí estamos.
So my educational level, I am wrapping up PA school. I'm about 6 months away from finishing and taking my licensing exam. And I'm doing that, like I said before, at the Betty Irene Moore School of Nursing at UC Davis. Even though we're housed under the School of Nursing, it is a PA program that learns the medical model. And so that's a question that I often get. And before that, I worked for about 2 years as an EMT on the ambulance, doing 911, critical care transports, working with nurses. And then I also worked in the emergency department at a level 1 trauma center in Southern California. And then before that, I graduated in 2018 with my bachelor's degree in psychobiology from UCLA.
Cool.
So yeah, it's been quite a journey, and I'm sure Aaron, you probably feel the same way. You like, oh, you close your eyes and you open them, and you're like, "We're here." Like,
How did we
how did
get
this
here?
happen? Yeah, and so it's an encouragement to everyone watching that like every season of life that you're in, every step that you're currently in is just part of that ladder to rise, and it all has value. I know as a pre-PA, and I'm sure I don't, as a pre-med, a veces nos sentimos como desesperados, like, oh, I need to get into med school, I need to get into PA
Mhm.
school, and then like my life is going to be chilling, like we made it. And that's very much how I felt like going in. I don't know how that experience was for you.
Yeah, absolutely. So there's like a really popular just like thing of people just want to rush into medical school, get in there. You think once you get in, it's going to be like, life is going to be better after that. And it only gets harder at each step and every level of training. So I think we just need to learn to enjoy to be in the moment, where you're at right now. It's something you prayed for, a year ago, a few years ago, something you've been working on, daily goals, and just kind of try to enjoy in the moment that you're in, because it's over before you think about it. And so just try and enjoy where you're at right now.
Question number 3 are specialties of choice, and talking a little bit about job flexibility. So I know kind of the elephant in the room is that you're going into family medicine, and you've already been accepted into, my understanding, one of the top family medicine residency programs in the country. And so please tell us more about that. That is amazing.
Oh man, yeah. So I decided family medicine kind of early on in my third year medical school rotation. So medical school is structured. The first 2 years are preclinical. You go to class, you learn all the physiology and all the science and theory. And then your third year, you go into rotations where you kind of figure out what you want to do. And then fourth year is pretty relaxed right now. But in third year, I was kind of I wasn't sure if I wanted to do like a surgical specialty or a primary care specialty. And so whenever I did my OBGYN rotation, I went to a rural hospital here in New Mexico at an IHS. If you guys have the opportunity to do rural rotations, especially at an IHS or just like a community hospital, definitely do it. I did an OBGYN rotation out there, and I loved C-sections. I thought it was the most amazing procedure ever in this world. I still think it is. And my OBGYN preceptor at the time, he was a male, and he's like, just go into OBGYN. He's like, if you love it so much. So I was thinking about it. And then I noticed that every time we would, have a delivery of a baby, I still wanted to know what was going on with the baby. If like they had to go to the NICU or if they needed anything else, like I still wanted to take care of the baby. So it was pretty easy for me to decide, like, no, I want to take care of the moms delivering the babies, be able to do C-sections, which is something family medicine can do with the right training. And then take care of the babies, and then also my viejitos, in the clinic. Those are some of my favorite patients to take care of,
Yeah.
because they come pretty often. So that's kind of how I landed on family medicine. My mentors before medical school, they're all family medicine mentors, and things work out the way they do, and it feels like I was just shunted into primary care from the beginning, and I wouldn't have it any other way, and I'm really happy about it. And yeah, I interviewed with a lot of programs around the country, from the East to the West Coast. I got the opportunity to interview at pretty much every single top program.
That's
And
amazing. Congratulations.
thank you. I think even after, the 5 years, I had like the imposter syndrome. Like,
Of course.
are these programs going to want me because I took 5 years to graduate medical school? And they absolutely did. They loved all the work I did with my comunidad, and everything I did just out in the community. So that's just how it all ended up working for me.
Yeah, and I'm sure that 5th year was just an additional year of experience, more season, more maturity, and yeah, like I always tell students, when after you graduate from college and you quote unquote take a gap year, don't view that year as a gap year. It's a growth year, not a gap year,
Yeah.
because you're going to be growing in experience, you're going to be growing in your maturity, you're going to be growing in your confidence to care for people. And
And I actually see it as a blessing of disguise, because this was around 2019, when the COVID pandemic kind of started up. So
yeah,
a lot of, if I had been in the class below or in the class that I was supposed to be in, I wouldn't have had the opportunity to do all these rural rotations or these like experiences outside the community. So like, reflecting now, like it honestly might have been one of the best things that happened to me.
yep.
So that's just how life works.
With family medicine, you have that flexibility to see the baby, see the mom, see the viejitos, And
Exactly.
yeah, if you could expand on that as well.
Yeah, so I think when people hear family medicine, they think of the doctor just out in the clinic, like standing alone, just taking care of hypertension, diabetes, and I don't know, maybe prenatal checkups if you kind of know that. But family medicine is so much more. So a family medicine training allows you to actually work in any setting within or without the hospital, minus, of course, doing surgeries. So as family medicine, yeah, you can do all the outpatient things, but you can also work inside of the hospital as a hospitalist, like internal medicine doctors do, taking care of those just wards patients. In rural hospitals, they can even run ICUs. I worked with many family medicine doctors that were running ICUs, intubating patients, extubating, stabilizing them out in the community to ship them out to like a larger academic center. I worked with family medicine doctors that ran whole ERs in the rural
Wow.
locations. And it's so much more flexible. And then what I really want to do as family medicine is get a surgical obstetric component. So family medicine can run labor and delivery units, delivering babies, but they can also get trained to do C-sections. That way, if something goes wrong, and we need to get baby out ASAP, family medicine doctors can do that. And that's kind of the whole, you can pretty much do anything except, specialty surgeries. But that's kind of what's so amazing about family medicine. I'm interested in all these different things, so I was like, it's perfect for me. And you can also do a lot of really cool surgeries in family medicine.
That's amazing, and that kind of resonates with kind of my own like journey and desire, because like going in as a PPA, I was like, I knew I wanted to do a bunch of things, and I had like a bunch of interest in medicine, and I just couldn't decide I couldn't see myself picking one specialty and doing that for the rest of
Yeah.
my life. And so I guess I'll answer this same question on my end. Coming out of PA school, because I've been in a very blessed position to receive this scholarship from the government called the National Health Service Corps Scholarship. And if you're a student that's been accepted this year to a PA program, I urge you, you probably have like, by the time I post this video, 2 or 3 weeks, April 27th is when this scholarship closes. You need your acceptance letter in hand, 2 letters of rec, and just a short personal statement. But doing those 3 things literally saved me like $200,000. And so I stress that like there are opportunities and there's money out there to
Yeah.
fund
Also
your
also for
your
medical students applying. Also for medical
yes,
students applying. So
yeah. And it's available to medical students, to PA students, I think also to like some mental health professionals. And so really I'll make sure to include those details down below. But I was getting out with this is that coming out as a new grad in PA is I'll be working in a family practice specialty. And so kind of like I'll be seeing kind of the similar populations. But my kind of big thing, or the reason I chose kind of the PA profession, was kind of an added flexibility component of being able to switch to some of these more kind of specialized specialties, if we would call it that. So as a PA, without having to do additional residency or fellowship training, you can switch from working in family medicine to kind of like Adon said, working in emergency medicine, or switching to something more specialized like rheumatology, being a rheumatology PA, or like renal nephrology, PA, or working in medical
dermatology.
oncology. And so really the opportunities are really limitless into what you can do with your PA license in terms of the specialties that you want to work in. Of course, there's some limitations in the scope of practice, which we'll talk about in a little bit. But yeah, you brought up good points that I hadn't even, considered with family medicine providers. And even from talking to the providers that I'm working with currently on my family medicine rotation, like they have experience working in the ICU. They have experience, intubating, extubating. They have experience, in community clinics providing that firsthand care. And so it just really, for the student watching this, like it really just depends what you want to do. If you know that God put you on this earth to be a neurosurgeon, we need neurosurgeons. Go do that. Like you're not going to scratch that itch by becoming a PA, and you're not going to scratch that itch by becoming, anything other than what you feel you've been put on this earth to do. And so that's my encouragement. But for those students that are on the fence about what they want to do in medicine, Aaron brought up good points about, becoming an MD in family medicine. And my points are, as a PA, is that you have an additional level of flexibility to kind of go into other kind of more niche specialties.
Definitely.
So question number 4, and we're kind of halfway through, is this issue of scope of practice. And I do want to, I guess I'll start this one with saying, I know some students kind of question, and there's been a lot of talk about mid-level kind of scope creep. And so kind of my perspective on it as a PA, like I signed up to essentially work under a supervising physician. There is a lot of legislation that's moving towards, this talk about getting us full practice autonomy. And that is not something that I wholly agree with. I do think that our MD counterparts receive a whole lot more of additional training. I don't stand in the position where like I would want to have full practice autonomy and not have, my MD counterpart being there to help me and then to consult with. And that being said, with our PA license, the other issue for this question, we're going to be talking about scope of practice, autonomy, and liability. I do think PAs have actually a lot of autonomy to see patients, diagnose, treat illnesses, prescribe medications, initiate antibiotics, pain medications. And as a PA, you end up getting your own medical license, and then you end up getting your state license as well. And you also get a DEA license. And what that means is that you're essentially, under your own license, you have the power to prescribe controlled substances. And that is huge. That's, a huge responsibility. And I don't take it lightly, but something to keep in mind, that you do have the autonomy to care for people and give them what they need. And then in terms of liability, I think there's some students out there who are thinking like, oh, I want to become a PA because I have less liability than an MD. But I would say no. Like at the end of the day, if you don't do right by your patient, you don't document properly, and you end up getting, God forbid, end up in court, for a malpractice lawsuit, like your license is still on the line, and your livelihood and all of the work that you've done to this point is on the line. And so I think the liability issue is kind of something that maybe is a little bit less if we compare it to our MD counterparts, but it's still there. It's still a component to I think keep in mind. We're like not out of the woods, and we're not in a position where like if I mess up, like it's on my MD's license. Like no, you have your own license, and you are liable for the medical decisions that you make. And with that, I'll let you kind of chime in on your perspective on these three topics.
Yeah, absolutely. So scope of practice, this kind of goes on why I kind of decided to be MD, because you are kind of making those decisions. And we do hear a lot about like mid-level creep and all these other things. But I have worked with so many amazing PAs. On my academic ICU rotation, we had a PA. He has been working in the ICU for, I think, like 20 years. And we were told from day one, they're like, he is basically like an ICU attending. Like he knows his stuff because he's been here for so long. So I think PAs, like with that years of experience, are way better than, a medical student for sure, straight out of a medical school, and better than a lot of residents too. So I think the experience, I'm big on like learn as you work, kind of learn as you do instead of from the books. That's just kind of how I learn best too. But that is definitely something like the scope of practice you have to think about between the PA and MD. If you are an MD, and you have in clinics, usually you have an MD that's kind of supervising maybe a lot of, nurse practitioners or PAs, and they come to you for questions, and you kind of have to make the decision at that point. But kind of like Mario said, I love working with PAs. You guys are so smart in certain aspects. We know things in certain aspects. So working together, like we can just take care of our patients so much better. And I've never had like any problems or issues, I guess, with that dynamic that people might think that happens online or in clinics or anything. It's definitely like a very, collegiate experience every single time. For autonomy, like that's why you're an MD, right? You have the full autonomy. But it's not that much different from PAs. It's just at the end of the day, if something like that's happening, you have that final decision, and that's kind of like the only one up per se, if you're, you know, working with mid-levels.
Yeah, I feel like that's a good way to put it. Yeah.
Yeah. But if you're not working with mid-levels, then, you know, that's like, you're the doctor taking care of them. And that's kind of why I wanted to do rural medicine, because in these rural locations, you're probably like the only doctor around. So you have to make decisions. And something that really stressed me thinking about this is like, I want to make a decision, but I'm scared that because I don't have like these resources, you know, for these patients, like it's not the right thing. But some of my mentors told me, they're like, that's why you're an MD, and you need to just make the best decision with the resources you have. And that's the best you can do. Like, you can't do anything like worse or better than that. And just figure it out for the patient. And you can't be reprimanded for doing your best out in these locations. So that kind of eased me a little bit, but I'm still a little bit scared to, you know, go to like under-resourced location and take care of my patients, but still really excited. And this kind of leads me into liability. So family medicine doctors are actually some of the least sued doctors in general, because we have that relationship with our patients. We've been seeing our patients, you know, for years. We've built up their, you know, that connection. We know where their kids go to school, or, you know, the community centers they go to. We see them at the supermarket. So we're far less likely to get sued, I think, just for that connection. And I kind of wanted to talk specifically in like the surgical OB field that I want to do. Family medicine doctors that have complications, you know, during C-sections actually get sued at like half the rates of OBGYNs. Also, they think it's because of this relationship you have with your patients. But yeah, liability is always like a big thing to think about. But that's kind of one of the big things I wanted to, you know, be a doctor, because I'm like, well, if I go through the training, you know, medical school residency, you should know your stuff. So it makes me less scared that I'm going to make a mistake on a patient, although mistakes happen all the time. I see them occur in the hospital all the time, even with like the most experienced doctors, you know, things happen. But like liability in family medicine is not that big of not that big in my mind right now. Maybe because I'm like just about to start residency, unlike Mario's about to start his practice. And I am too, but I'm still going to be, you know, I still have supervision for the next 3 years. So I guess that's why I haven't thought about it too much more past like what the data and stats are telling us right now.
Yeah, you make really, really good points. And at the end of the day, I do feel like from my PA training that we are kind of receiving adequate training to you know, do the proper documentation and make sure that we're, you know, documenting everything we need, and also just kind of being, I feel like at least at my program, we're also being trained, especially with the preceptors that I've had, like where that kind of limitation is for PAs, where you want to consult, you know, your MD, supervising physician, or, you know, other consulting services. And so I definitely feel like the training is preparing me to like provide that care, and then also know where I'm like kind of getting out of my comfort zone. And of course, that'll develop even more with time as I'm in practice. I'll get even better. But yeah, that's something that I just wanted to mention. And also, one of the things that I've noticed too is practices that really incorporate NPs, PAs. I feel alongside the MD and DOs. I feel like our practices that are more like team oriented and are really focused on providing that like patient-centered care, where you have, you know, the PA, the MD, you know, everyone's caring for that patient as a team, and collectively with all of our experiences and our knowledge and wisdom, we're making the best decision for our patient. Because at the end of the day, that's what it is. Like just trying to do right and do the best for that patient that's on your service.
Absolutely. One thing I wanted to ask you, Mario, real quick. In my experience, or kind of what I've heard is, you know, like for patients that come into the clinic, and MD kind of gets like maybe some of the more complex, and the PAs maybe like less acute, less complex patients. I don't know what your experience has been with that. Mine has been kind of hard because I haven't really worked like with too many PAs out in the community, and in the hospital we're all working together. So I guess I don't know if you experienced anything like that.
Yeah, I feel so I did a little bit. So working in the emergency department, you would see of course, the attending physician, and there's a lot of residents in because it's a teaching hospital. And then in the ED, we also had a fast track, like urgent care area. And that area was completely staffed by 3 to 4 PAs or NPs. And so in that, you would have your lower acuity, your less sick patients going through. People with upper respiratory infections, or with just, like all they're having is an abdominal pain. But through there, you would get really sick individuals. And so it would be up to the PA and the NP to identify and start the workup for, that critical patient. And there were many times where the PAs would, see this patient, and then, that clinical acumen of like, this patient is sick. They need an ICU bed or something, and just get the ball rolling. And so you would still get that exposure to some of that sicker population. I imagine out in like practice in like rural medicine, it really probably depends on the clinics per se and the amount of help that they have on hand. And there's some clinics where I've seen where it's just the PA and that's the only provider there, and their consulting physician is someone that's, like hundreds of miles away, and they're a phone call away, which is amazing. But yeah, there are places, out there where if the need is so great and the only available provider is a PA, where they are the sole provider. All right. So now moving on, work-life balance and stress levels. Yeah, I guess I'll let you take this one and kind of talk about work-life balance and kind of I know right now you're kind of in a weird kind of transition period where you're coming out of med school, kind of chilling, and then about to start your residency. But maybe you can expand on your experience in med school and how you had that work-life balance, if you did have. I know it's difficult to do even for myself in PA school, and kind of the stress levels that you've experienced, and also what you expect to experience during your family medicine residency.
Sure. So kind of through medical school. So like my preclinical year, so I don't enjoy really like studying per se. I really like the material that I was studying, but I'm just not like naturally smart like some people. So I have to study a lot to kind of understand the material and, get to that next level and make sure I'm mastering the material. Yeah. So I had a lot of stress during my preclinical years. And then third year of medical school is the hardest, but also the easiest. And what I mean by this is your rotations, like you're paying to go to work, 40 hours a week, sometimes more. And then on top of that, you have to study for your shelf exams at the end of every single block. So in the family medicine, you have to do a family medicine shelf at the end, which is really difficult. Like internal medicine, I think was the hardest just because I think family medicine was the hardest because there's like the scope is just so broad.
Yeah.
And pediatrics was also extremely difficult. But the hours in third year, like you're showing up at 5, 6 a.m. at the hospital to pre-round. And by pre-rounding, I mean, you go in, you see what labs the patient has had drawn, if they needed anything drawn, you go talk to the patient. And then right before rounds where you present your patient and your plan to the attending. And this can take, all morning. It can even run into the afternoon as we're making plans for patients and seeing patients. And then, in the afternoon is like procedures and following up on questions from the nurses and seeing patients that come in admitting. So it's really long days. You're running around. And as a medical student, your job is to perform at the highest level possible. So, every single day you're coming in like at 110%. And then to go home and study after that was really difficult. I love the clinic. So like that 110% throughout the day was, the highlight of my day. And then going home and studying was harder for me. And the hours were just kind of ridiculous, honestly, in third year. Your first 2 years, depending on the medical school you go to, I decided not to go to any lectures that weren't required. I kind of focused on standardized materials just for step 1 and step 2. And I did really well just doing that. But you kind of just have to know who you are and know yourself on how that'll work for you. Fourth year, the beginning of my fourth year was really stressful because I did a required ICU rotation right at the beginning, which I loved. And then right after that, I did my sub internship. So this is where you show your specialty, like you are ready for the specialty and you're ready to go. And I did mine in maternal child health. So this was family medicine placed within a labor and delivery unit. So delivering babies, taking care of moms and the babies. So, I was working my butt off, not going to lie. Like I would show up earlier than the interns and I would sometimes leave later than the interns just to show that, you know, I'm dedicated to this and I really want to learn this. And it paid off, you know, like massively. I got to do some really insane laceration repairs on some women, you know, that gave me the opportunity to do that. And my letters of rec were amazing for residency. And I specifically know that's one of the reasons why I got into the residency that I got into, just because of the work I did just specifically in that sub-I. And you're actually supposed to work some nights on your sub-I, but the service that I was on was so busy during that month that they're like, we just need your help during the day. Like, please come help us. So I got off not doing nights. So I'm a little bit scared for nights in residency because I haven't done any on L&D nights, but that's kind of how that was. And now 4th year, I have zero stress. Like, I'm just waiting to a little bit more stress now because I need to move to Colorado, and
a different kind of stress.
Exactly. Finding housing and filling out a lot of paperwork, background checks, but it's easy at this point.
After all of the stuff.
I'm excited to get started. That's kind of how med school went for me.
Heck yeah.
Yeah. How about you, Mario?
So let's see, starting with kind of, I guess, didactic here. Didactic is essentially the best way to put it is like drinking from a fire hose. Essentially, if we compare, you know, PA school in total is 27 months, and the first year is didactic bookwork, similar to kind of the first 2 years of like the preclinical clinicals that you just described. And then the final year and some change is our actual 5-week clinical rotations, where we go into emergency medicine, family medicine, internal medicine, and just really get that exposure to a lot of the specialties that medicine has to offer. But that first year was definitely stressful. It's you're having exams back to back. If we were to compare, I think med school to PA school, I feel like you can imagine a street and that like a main avenue and then a bunch of little drives. PA school, you're kind of barreling through that main road and not diving into those short streets and spending time in diving into the nitty-gritty biochemistry and microbiology and deep pathophysiology of diseases. So we kind of just barrel through and get a basic pathophys, but definitely also get everything else like treatment plans and like how you're going to treat it, what the common presentations are. Because again, we're being trained as generalists. And so, yeah, with that kind of training and we were receiving a huge volume of information. It was not uncommon to have 2 or 3 exams per week, every, you know, two weeks. And so just navigating that and kind of, I'll be honest, it was like stressful. There was times where I was just studying like Monday through Sunday. At the beginning of the like PA program, I feel like I was studying a lot more because I was just like, you know, the fear of like failing and a little bit of that imposter syndrome kind of drives you to try to, you know, be the best that you can be. And then as time has progressed, I feel like I figured out how to study effectively using like actual science-backed like methods, and then it kind of things started to click in terms of how I would approach my exams, and then I started studying, you know, less and less, but still performing at the level that I wanted to be. Now during clinicals, it's night and day. It is, I'll just be honest, better than didactic. Like I also enjoy like just being hands-on, being in the clinic. And it's just less exams. Instead of taking 2 to 3 exams every other week, now it's just 1 exam, similar to the shelf exam. We take end of rotation exams every 5 weeks for whatever block you're in. And so right now, kind of like how you said, the family medicine one is an intense one. I have that coming up. I have that exam coming up in 4 weeks.
Yeah.
I need to kick it into high gear, doing my Anki cards and start doing my practice questions. But I feel like overall the stress levels during clinicals are a lot less compared to didactic here, just because of the sheer volume and speed in which we're barreling through these
Absolutely.
topics.
I think so too.
Plebes, if you got to the end of this video, gracias, you're a real one. And just so you know, there's about 20 more minutes of footage left, and that's gonna be available part 2 on our own Trillo's channel. I've attached the link down in the description below. In that video, we talk about things like our earning potential as a PA versus an MD, and then just offer some tips for those of you that are on the fence for your decision. Again, make sure you go check that out. Link in the description down below. Animo plebes, thanks for watching. Saludos.